going to discuss about aphakia. So it is in the optics and refraction chapter. So A means absence, phaco means lens. So it is absence of lens is aphakia. So from where lens is located in the pupillary area, no? So from the pupillary area, if the lens is means it is removed, then it is known as aphakia. In mere medical terms, it is like that. So it produces high degree of hypermetropia. Okay. So what are the causes? You guys should tell me the cause. So take some 10 seconds and think what might be the causes of absence of lens. So first maybe congenital, which is very rare. Okay. Second maybe any trauma and the lens may be broken, and it might get absorbed. Okay, it might be broken and it might be absorbed. Okay, and sometimes there will be traumatic exclusion of the lens, means there is a trauma, the lens get dislocated from there, and sometimes there will be the lens will be posteriorly falling into the vitreous chamber, which is leading to the optical aphakia. Okay. So, and surgical aphakia, you know, it is common condition for cataract, post cataract you will see aphakia. Okay, these are the common 5 causes of aphakia. Okay, so coming to the optics, normally the power of the eye, total power is 60 diopters. As you saw, aphakia produces high degree of hypermetropia. So what is the power in the aphakic eye? The power will be 44 diopters. Okay, anterior focal point, which is in normal eyes it is 15.7 mm, but in aphakic eye, due to the absence of the lens, the anterior focal point will be 23.2 mm in front of the cornea. Posterior focal point, it is 31 mm behind the cornea, that is 7 mm behind the eyeball. So when you consider anterior posterior length of the eyeball, which is 24 mm, then you said we had already discussed the posterior focal point. Anterior focal point is 23.2 mm in front of the cornea. Whereas posterior, it is anterior, so it is in front of the cornea. Posterior, it is behind the cornea. 31 mm behind the cornea, we said. So anterior posterior length of the eyeball is 24 mm. So 7 mm, it must be 31 mm minus 24, which is 7. So how much it is behind the eyeball? Behind the eyeball means 7 mm. Okay, 7 mm behind the eyeball. So here accommodation is lost fully. So clinical features, defective vision will be present due to the absence of the lens, and okay, there will be defective vision, and erythropsia, synopsia means there will be reddish, the person may be seeing reddish and bluish images, which is due to loss of accommodation and again defective vision. So what are the signs present? There may be limbal or surgical scar, which suggests that there is some previous surgery to the eye, so which causes aphakia. So you must see in the patient whether there is any limbal or surgical scar is present. So, and anterior chamber is deeper than the normal, as there is hypermetropia here. So it will be deeper than the normal. So iridodonesis will be present. Pupil will be appearing in jet black in color. Purkinje image test, you will see only 2 images. In normal eyes you will find 4 images, but here in this condition aphakia you will find only 2 images. Okay, so I will show you the picture which is there in our Qurana. They depicted how normal eye it will see, means how it will be seen. The 4 images how it will be in normal eye. So here your picture. So this is, see, these are Purkinje images. How our eye will get 4 images. See, first you will when you see the object directly, you will find first inverted image. then it will get erected after first refraction like that, and at last you will see erected images, and you will find at last only one, means perception is at last only one image. But normally how many Purkinje images will be there? 4 Purkinje images in normal eye, whereas in aphakic eye only 2 Purkinje images, because lens refraction there will be cancellation of the lens refraction. Okay, that's it, the diagram. So fundus examination, you will see hypermetrophic small disc will be seen. If you do retinoscopy and auto refractometry, you will find high hypermetrophic findings. So what is the treatment? First of all, spectacles. So we have to correct the refractory error by convex lens of appropriate power. For correcting the aphakia, first one is spectacles, second one is contact lens, third one is intraocular lens, and refractory corneal surgery. So spectacles, so which power is recommended? What are the, means first we have to know, means whether it is concave lens is needed, convex is needed, cylindrical is needed, which is needed. Concave is for myopia, convex is for hypermetropia, cylindrical is for astigmatism correction, and like that. In myopia you will use both concave and convex lens, as there is both defect is there. So here you should use plus 10 diopter cylindrical lens, which is usually for surgically induced aphakia, means astigmatism, to correct the aphakia. So in addition of 3 to 4 diopter near vision to compensate the loss of accommodation. As we saw before also, there will be loss of accommodation. For that correction you should use again plus 3 to plus 4 diopter lens. Okay. So what are the disadvantages of using spectacles? Image will be magnified by 30%. Okay. For unilateral aphakia you can't use that. Okay. Because of pin cushion distortion will be there, and problem of there will be spherical aberrations will be there, chromatic aberrations of the thick lenses will be there. About these aberrations you have already came across in physics also. So there is a problem of here aberrations. Field of vision is limited here, and prismatic effect of thick glasses. There will be roving ring scotoma, cosmetic blemish in young aphakia. So if you use contact lens, we had already discussed contact lens favors the growth of pseudomonas. Yes, right. And contact lens you should not wear during the night. You should be very cautious. You should keep it away when you are sleeping. You should not keep that and sleep. So what is the advantage of contact lens? Means it causes less magnification of image, elimination of aberrations. As we saw before, there will be spherical and chromatic aberrations, so you should eliminate that. By contact lens you can eliminate them, and prismatic effect of thick lens also can be eliminated. Wider and better field vision will be there. Cosmetically it is more acceptable, better suited for unilocular aphakia. Disadvantages will be there's more cost of the lens, cumbersome process to wear, and in old age and in childhood it is very difficult to wear them. Corneal complication, corneal ulcer will happen due to this contact lens, due to the pseudomonas, bacterial corneal ulcer will occur. So intraocular lens implantation, primary will be there, secondary is there. Primary during the cataract surgery, secondary which is done in already aphakic patients, you will use secondary. So refractory corneal surgery you should use in hyperopic LASIK. Okay, and secondary IOL can't be implanted, you should use this. Thank you guys, that's it for today.